Hello, my name is Alex Farid. I'm a current fourth year student at Harvard Medical School and first author on the recently accepted cost effectiveness analysis for humeral shaft fracture management. We had noticed a trend towards research efforts to establish cost effectiveness when determining treatment options for various orthopedic injuries. Humeral shaft fracture is one of several orthopedic injuries for which operative versus non-operative management remains debated, with decisions made primarily based on various patient-related factors. Further, cost effectiveness was yet to be established for this fracture type. Thus, we pursued this study to fill that gap in the literature and ideally to provide surgeons an additional data point to consider when determining appropriate management for humeral shaft fracture. Cost effectiveness studies are performed by determining cost and prevalence of each treatment option and effectiveness following each of those treatment options via functionality measures. There were challenges presented for both of these components. There was a relative lack of literature commenting on the prevalence of each treatment option included in our decision tree. Fortunately, we were able to reference a reliable and well-performed study describing the prevalence of each of these treatment options. With regard to the other component of the cost effectiveness equation, perhaps our most significant challenge was accurate reporting of the upper extremity functionality following each treatment option. Cost effectiveness is historically measured using quality adjusted life years, or QALYs, which are based on multi-attribute utility system, or MAUS, measures, such as the EQ5D, the SF36, or their derivatives. There was a distinct lack of literature using these measures over a sufficient time frame that could have been used for this study. We did find, however, relatively consistent use of the disabilities of the arm, shoulder, and hand, or DASH questionnaire, across several studies and up to 1 year post-surgery or post-treatment initiation in the case of non-operative management. Thus, we were required to find a way to utilize DASH in a cost-effectiveness analysis, which our fantastic statistician was able to do under the guidance of his expert mentor and senior authors on this study. Ultimately, we were impressed that operative management was able to demonstrate improved cost-effectiveness over its non-operative counterpart under almost all circumstances, as analyzed by various sensitivity analyses, as discussed in our study, despite its significant absolute cost relative to non-operative treatment. This pointed to a potentially significant benefit of faster return to baseline upper extremity functionality when managing this injury operatively, particularly among patients who are wage dependent. Non-operative management was favored only among patients who are not wage dependent and who have a higher than average likelihood of union as determined by various patient-related factors. It is our hope not that practitioners change their practice based on these findings. Certainly, there are more important considerations to patient management than cost effectiveness of different treatment options, but rather that practitioners may be able to use the results of this study as an additional data point to consider for cases for which decision-making may prove particularly challenging. Thank you.